Life in regional New South Wales is beautiful and rewarding. However, there are real challenges that need to be acknowledged as well. In 2020, the New South Wales Parliamentary Inquiry into Health in rural and regional New South Wales was established. The findings, my friends, were stark. We heard that regional New South Wales had significantly poorer health outcomes, greater incidence of chronic disease, and unfortunately greater incidence of premature death. For example, rates of coronary heart disease, kidney disease, stroke, and every type of cancer were all higher for those living in regional areas compared to those in metropolitan areas. That meant that people living in the regions had, on average, a 2.2 years less in life expectancy than those in metropolitan areas. We heard that there was a critical shortage of professionals across rural and regional and remote communities. Government and local health districts, state and federal, had been unable to attract, support and retain essential frontline healthcare professionals. This is especially true of doctors and nurses and other allied healthcare workers in our regions. They love their job, they want to help, but they can't stay very often, and there just isn't enough of them. This is also significant challenges in education. Yesterday, the Auditor General released a report into rural and remote education. The report said that 2 years on from a strategy that had been developed, that, quote, it was unlikely to achieve its vision that every child in regional New South Wales had access to the same quality of education as their metropolitan peers. The report went on to find that the number of permanent teacher vacancies in regional and remote areas grew from 591 in 2018, not that long ago, to nearly 1,000 in 2023, which was a massive increase of 56%. Now, we know the challenges ahead of us. Children outside of major cities are less likely to meet the NAPLAN minimum standards for reading and numeracy. Across years 3, 5, 7 and 9, the proportion of children in major cities above the minimum standard is 81% for reading and 83% for numeracy. For those in the bush, that drops to 54% and 52%. The AG's report has prompted an urgent response by our government, and I can say that we've tasked senior education executives to reprioritise rural and regional remote students, putting an absolute fresh focus on initiatives that will deliver the biggest impact for the bush. Because education is the key to our future, and of course it can open doors which had previously been locked. So no matter where you live in New South Wales, you should have access to world-class education with highly trained, highly skilled educators. Friends, that's why we're taking action. We've begun the long overdue task of repairing and reforming our healthcare system to start with. We've busted the wages cap, delivering the biggest pay rise to public sector workers in New South Wales in over a decade. In fact, I can inform you that our wages offering will deliver an additional $124 million boost to salaries for public servants that work and live in regional New South Wales. That will have major flow-on effects to businesses, communities and the regional economies across this state. That was our first step in resolving just part of the state's essential worker recruitment and retention crisis. But it's not the last. We know that recruitment is key, and that's why today I can announce that the government will double incentives for healthcare workers to move to regional communities from $10,000 to $20,000. We have to grow our workforce. Thank you, sir. We have to grow our rural and regional workforce in remote areas. We know that workforce and skills shortages are contributing to inequitable outcomes in the health sector. The previous incentive, which was set in 2010, was never reviewed despite obvious and clear strains on the health system if you speak to anyone in any regional community. Now, we believe these incentive schemes do work, particularly in recruiting and retaining key workers, particularly in areas that are hard to fill. But we need to make sure that they're working for those that apply. Otherwise, the impact of isolation, being away from family and social networks, means that they feel isolated, many people, and as a result, those incentive schemes won't work. So we're determined, if this scheme doesn't work, to come back to the negotiating table, to come back to the table, to work with regional communities to make sure that we can recruit and retain essential workers in the bush. We believe this is an important step, but I've heard countless stories of experienced nurses and midwives who are either dropping their working hours or worse because they don't feel supported in the workplace. It's why we've begun the transition to safe staffing levels in New South Wales hospitals. When it comes to health in regional New South Wales, as a community, we can't ignore those who tell us there's a problem. We must listen, understand the issues, and then take decisive action.